There are different types of the condition alopecia. The most common is alopecia and areata, which is the one actress Jada Pinkett Smith revealed she suffers from in 2018. So what exactly is it, and is there a treatment? This morning, Dr. Kumar joins us to talk a little bit more about this and the risk factors. Good morning, doctor. Thanks for joining us.
Good morning, Leslie. It's good to see you.
Good to see you as well. So, of course, we know a big topic that happened this weekend happened at the Oscars, but really at the center of it is what is alopecia and what are some things to look for?
Yeah, alopecia is a very common condition. It just means hair loss. I mean, just a medical term that means hair loss and you lose your hair. And there's numerous different reasons why people lose their hair. You know, commonly you see people that are undertaking therapy, chemotherapy, and the fastest growing cells are the ones that perish. And usually it's cancer cells. And so as a side effect, it's very common for people to lose hair as a result of medications. There's other conditions, autoimmune conditions, there's thyroid disorders, there's stress, in fact, can all cause hair loss. But the condition that's affected Jada Pinkett Smith is this condition that you mentioned, alopecia areata. And while the exact cause isn't known, it's believed that it might be some kind of autoimmune condition. And it can be quite distressing because your hair can fall out in little quarter-sized clumps. It can regrow over 6 months to a year, but then another patch of hair falls out. And but eventually it just looks, displeasing to the person affected. And they do what, Ms. Smith did, and they just shave their hair and embrace their alopecia.
Yeah, Dr. Kumar, how common is this, and what are really some things to look out for? I myself had something similar to this, but mine was stress-induced, and I've since not noticed any more hair loss. But what are some things to look out for?
Well, to answer your first question, how common it is, about 1 in 500 to 1 in 1,000 women are affected with this. And I say women, rather than men, because it's very common in men. We've seen a lot of bald men, and we don't make note of it. That's just male pattern baldness, and it's hard to know exactly why that happens. But in women, it's about 1 to 5,000, 1 in 500 to 1,000. It's more likely to affect Black and Hispanic women than non-Hispanics. And the condition, we just don't know why it happens, but sometimes there is therapy for it. Like you've said, it's stress can cause it, and certainly a shocker like childbirth or a death in the family. People have noticed that they lose hair, but typically that hair grows back. This condition is usually slowly progressive. There is treatment. You could put topical hair growing stimulants or anti-inflammatories. They actually use the same kind of medications we use to treat rheumatoid arthritis and inflammatory bowel disease in the same condition, to some modicum of success. It isn't universally applicable, but oftentimes these conditions are patchy and they're short-lived, and hopefully most people that have them are affected in that manner. But there are some people that it's just a slowly progressive disease for which even anti-inflammatories, topical medications don't work, and then they're left with total alopecia or baldness.
Yeah, absolutely. And then finally, we realize and recognize how important hair can be for women who you say are most open to having this condition. What are some things that maybe they should talk about with their doctor?
Right. Well, you got to first make sure that you tell your physician about all your extra conditions. Now, your physician is going to check your thyroid levels, going to do a metabolic profile. They're going to check on different conditions that you have, to do a blood count. And if there's nothing else that shows up, then you should be clear to share with your physician any kind of homeward, inward stress. And maybe therapy for that might be what's most relevant rather than treating the topical condition. But you just got to be very open with your doctor and be open to the solutions that he might offer. There's a lot of cosmetic surgeons out there that really specialize in this, so you shouldn't feel like there's no treatment for this. There's tons of treatment for it. It's a very common condition, and so there's a lot of therapy.
Yeah, really approaching this as a whole health. Well, we appreciate your time this morning, Dr. Kumar. If you have any questions for Dr. Kumar, you can email us at askdrkumar@gmail.com. Also visit his website, drkumar.com. We appreciate your time as always.
Thank you.